So hi, everybody. I know we are getting a few more folks joining us this afternoon. So I hope everyone's enjoying the beautiful day and getting a chance to get out at some point. We're going to go ahead and start our webinar in just a second. So just pulling people into our room, and very excited to have our colleagues from United Way 211 joining us. So we'll just give it another second and we'll get moving. Okay, great. So hi, everybody. I'm Andy Dwyer. I work with Erin and the Patient Navigator Training Collaborative team, headed up by Dr. Patricia Valverde. We're delighted to work with also the Alliance for Community Health Workers, Navigators, and Promotores de Salud to provide today's offering around resources related to COVID-19 with United Way 211, who's been a great partner for all things resources with the PNTC and many of our Colorado partners throughout the last decade that we've all worked together. So I'm delighted to have David and Allison from the United Way 211 team joining us to talk about some of the resources, and then really focusing on those that are most pertinent to the COVID-19 pandemic and being responsive to the need and the crisis at the time. And then we will also be joining Paulina from, and Erin, would you mind giving Paulina's background quickly?
Yes, so Paulina works with Adelante Network in Jefferson County, and she'll be joining us a little bit later to talk about their Spanish language resource run by Community Navigators.
Great. And so with our three presenters today, we're going to get a chance to hear about two great resources that are helping folks in the time of this pandemic and being, again, really supportive and responsive to the needs. We will have David and Allison with us until 2 o'clock. So we will be answering any questions right after their presentations, followed by Paulina's presentation. So Erin, can you lead us through some tech checks, and then we'll do a little more of a or some sharing a bit of what PNTC is offering for supports and resources, and then we'll move to our presentation today. So Erin?
Sure, so if you navigate down to the bottom left corner, you can adjust your audio options. Sometimes that's nice to increase your audio, so you can find those options there. You can always chat me for tech support if you need help. And also I will point you in the direction of the Q&A button. It's in the bottom middle part of your Zoom screen, and that's where we'd like you to type in your questions at any time during the presentation, and we'll make sure that our speakers here address them at the end.
Okay, great. As many of you know, PNTC has been offering the happy hours for our community health worker, navigator, and care coordinator community throughout Colorado. So we're excited to continue on those throughout the summer. Erin, do you want to share a little bit about those resources?
Sure. So we have two exciting things going on right now. We have the last happy hour this week, so that will be on Thursday, tomorrow, the 25th. You can sign up on our website, and that one will feature an all levels workout led by a personal trainer, and that's at 4:30 Mountain Time. And we also are offering Tai Chi every other Friday, which is amazing. And we've partnered with this youth organization to offer Tai Chi all on Zoom, and those are free and open to anyone who wants to join. And there is one this Friday, the 26th. So I encourage you to sign up on our website, and those that get our newsletters, the link is right there, but otherwise I'll put the website in the chat so you can check that out.
Great. And we did just finish out a mental behavioral health series this last month, and all of the webinar recording and resources are saved on the PNTC website. And also last week had a chance to share best practices working in a variety of settings related to navigating folks through the COVID-19 crisis, as well as for medical resources, basic needs, and then really thinking about how to adapt workflows and the like. So all of those resources are saved on the PNTC website. And then we'll have Erin share any of the upcoming opportunities. But I think moving into today, I'm delighted that David and Allison from the United Way team will be sharing those resources that we've spoke of. And again, United Way has been a huge partner of PNTC over the last decade. We really thank them for all of the effort and the great work they're doing within the Denver metro area and all their surrounding locations. So thank you guys so much for being here today. I'll turn it over for you to you, and really excited about hearing about any updates that can be helpful. So David and Allison.
Awesome. Well, hi guys. Thank you so much for allowing us a chance to come in and say hello. We certainly do appreciate that. As we start getting our slide deck up, I just wanted to introduce myself. I'm David Holland, and I manage our 211 Center. We take contacts from multiple medias, but that's what my role in here. Let me introduce our co-presenter.
Hi, I'm Allison Mclean, and I am the resource supervisor here at 211 at Mile High United Way. And so my team really puts together all of the information of all of the resources we can find across the state and keep them up to date and ready to go for clients to access all of the resources they need.
Okay. You want to go ahead and take us on in there?
Yeah.
Awesome.
So a little bit of background. We weren't sure how familiar you all are with Mile High United Way's 211 Help Center. So just a little bit of background. We are a confidential and multilingual service that refers callers to health and human service resources. We help callers navigate the confusing maze of information and services. It can get pretty crazy trying to find the right services for people. We provide coordinated, accurate, and up-to-date information to our clients, and we're accessible through call, chat, email, and text. And then eventually one day when our building opens again, we'll take walk-ins once more, but that is temporarily unavailable. And so really today what we're really hoping to accomplish is to equip you all with information on the best way to search and deliver resources, and to share perspective on trends, the future direction of 211, what we're looking for in the future, and then to give some helpful tips and some ideas on the process of finding these resources for individuals. And then at the end, we'll offer some time to go through questions and hopefully be able to answer any questions that you all have. All right, so a little more into 211. We have over the years developed several partnerships with other organizations, and the goal in that was just to be able to offer specialized information and some additional services to our clients. We utilize the information that a client will provide to us to determine if there are additional resources that are available that can go beyond what the client initially asked for. So for example, if we have a client that calls in that is in need of food immediately, we will try to find that food pantry for them, but then we'll also check, hey, do you need a ride to be able to get to that food pantry? Do are you able to get there on your own? And if they do need that assistance to be able to get to the food pantry, we're able to coordinate a ride through Lyft for them and get them to the food pantry, get them a round trip ride so that they can get back. And then we'll also ask if they've applied for SNAP and if that might be a possibility for them as well, and coordinate that application. We've worked with Hunger Free Colorado to be able to apply with clients over the phone and get that submitted to get that process started for them. So that's one example. Right now, we've also partnered with an organization called Impact Charitable to be able to support another group of individuals that maybe have been left behind by the CARES Act and by the current unemployment options that are available, and that's called the Left Behind Workers Fund, where those individuals that don't have access to unemployment or did not receive a stimulus payment are able to access $1,000 in cash to go toward whatever need they have in the moment, which can include rent, utility, food, any of those pieces. And so that's just kind of to show a little bit more of how 211 is really working to go just beyond simply providing whatever information a client specifically calls to ask about, but that we can assess a situation and really meet a wide variety of needs as we talk to them. All right, so a little bit about our database. We have around 7,500 services in our database. So it's a pretty comprehensive set of resources that span across a wide variety of health and human services. Sorry, it looked like that got cut off our screen a little bit there, but the full array of health and human services. Not all organizations are actually eligible to be included in the database. We have a pretty comprehensive inclusion and exclusion set of criteria that we make sure all organizations align with before we enter them, and we also verify those services before we enter an agency and do that work to make sure that we're giving out reliable and accurate information. Once we've added an organization and their services to our database, we will assign all of those resources into specific categories. We use a total of 22 categories, and those range from rent payment assistance, food or meals, childcare, volunteer opportunities, mental health services, dental clinics, medical clinics, other kinds of health care. And so really, if a client is calling in for any kind of health or human service need, we have resources across all of those types of needs to be able to help that client. We maintain our resources as frequently as possible. We'll do that using a variety of methods. We do calls to agencies, or we'll reach out by email. We have several agencies that we have closer partnerships with, and they will reach out to us whenever they have any changes that they make. We hear from our clients pretty frequently if they've heard of anything and they want more information, so that way we can include that new updated information into our database. Some resources that we know that we are giving out the most frequently, we'll make sure that we schedule a time at least once a month to reach out to those agencies offering like rent or utility assistance to make sure that they still have funding available. And then we'll keep checking in to make sure that once it runs out, that we have that information immediately and are able to stop our referrals to those programs that have run out of funding. At a very minimum, we will review all agency information that we have at least once a year. And with maintaining, over 7,000 services, it can be a little tricky to try and update and keep up to date more than that once a year. So yeah, that's kind of the background on the database. So now we'll go ahead and go into our website, 211 Colorado. So I will see if I can get my link to work here. Maybe, maybe not. All right, so once you get to the website, there is a variety of different ways that you can search for resources. As you see, you can go ahead and start typing in there, but before we go into that, I wanted to show you this search by category feature. And if you click on that, you'll see all of our most common basic needs that people are calling in for. And when you click on that, it will provide a list of the most commonly requested pieces under those categories. So this is a great way for people that aren't sure exactly what they know a general idea of what they're looking for and what they need, but they don't know the best terms to search for that. And so this gives them that option of, okay, do I need a food pantry, or am I really looking more for information around SNAP and the food stamps program? Or do I really just want a couple of meals in the moment? And so when you click on these, it will take you through a guided search to find all of those resources that meet that term, and it'll show you all of them across the entire state. If you're looking for a specific area, all you have to do here is you can type in an address. If you don't want to put in your address, you can just type in your city or zip code. There is a feature where it can look up where you are and just tag that in automatically using geolocation if you have that turned on. So if I just put in, I want to know what's in Denver, I can add that in there. And here's my list. I have 63 services for congregate meals or nutrition sites. And I can scroll those and see what works best, you know, what eligibility pieces there are, make sure that, you know, I'm eligible for whichever service I'm looking for and that it meets my needs. I can also, if I don't want to use that guided search, I can go back to this main page and type in something more specific. I can use a keyword, such as if I was looking for, I know I needed food. I could just type in food, and then it'll give me a bunch of suggestions down below that I can select from as well. Otherwise, I can just type whatever that keyword is that I'm thinking of and hit search. If I go ahead and select that, sorry. All right, so now it's used my geolocation services to know that, okay, we're searching in Arvada. When I look for just food in general, I show 164 resources. Here they are coming up on my map, and it's sorting my list based on what is closest to me. And so that way I'm able to find, maybe if I don't have a vehicle and I need to be able to find a place that I can just walk to, I'm gonna have those resources right at the top. All right, the next piece that I wanted to show you on our website is our COVID-19 resource page. I know that you all were interested more in what we have around COVID-19. So when I go to our COVID-19 page, I have different topics broken up into different tabs here. And so depending on what specific types of resources you're looking for, this can provide a lot of great information and resources in each of those categories. One of the things that we have recently added is a comprehensive list of COVID-19 testing sites where we've partnered with Colorado Department of Public Health and Environment to be able to list all of those testing sites across the state. All right, so once I pull up my resources and I'm determining which ones I think are going to be the most valuable, I can do a couple of things from here. I can decide, hey, I want to print this resource out, or I want to share it with somebody else. And when I click to do that, I can either send it through an email, or I can even text it to myself so that I have that resource available later on. I can also just get a link to that resource that I can then copy and send out in a different method if I prefer to do it that way as well. All right, so not only can I just print and share a single resource, I can also create a list of resources for myself. And you'll see in this top right corner, there's the option of where you can sign up to have an account with the website. And that way you can save and store any lists that you create, and then you can go back to them, print them out at any time, send them whenever you like. You can keep them updated as you go. And so it's a really great way if you're finding you're consistently getting people calling for food pantries or right now, COVID-19 testing sites. You can just keep that list and just do a quick update every time you log in, and then have it to either print out, to email to people. It's available for you whenever you need it. All right. Going into what kind of information we have available for the resources, when I click to see more details, you can see that it offers a general description of what is being offered, who's eligible for that service, and then also its location, what languages are offered, phone number, and then its hours of operation as well. It also will provide, if available, a link to that testing or that resources website. And then it will also provide, hey, this agency also offers these additional services at these additional locations. So it kind of tries to give you a comprehensive view of the agency and its individual services that it offers. One thing that I did want to note is that you can search for resources both by clicking back on this and getting to our main page, clicking from here. You can also just continue to search once you're in that search page. You can modify your search up at the top, and that you don't have to come back to this main home page. All right, let me see if I can get us back now to my presentation. Sorry.
Okay. Allison, while you're doing that, we just had a couple questions come in, and I'll let you maneuver that. So I think, David, you could answer this. Back to the discussion around the lift and transportation with you guys in the presentation there. How many rides are people able to get through the lift? Is there a limit? And is there a charge to set up the lift for folks?
I'll answer those backwards. There's not a charge, okay? In terms of the number of rides, we're funded through a grant buy lift in terms of making those available. There's not necessarily a set number, but we do try to focus around areas that are relevant because we have a limited number of rides, okay? So if someone's trying to deal with food instability, they're trying to deal with employment, they're trying to deal with medical issues, we can set up those type of rides, including even maybe scheduling a weekly ride if that's appropriate. We are limited from trying to set up a ride to go visit the grandkids, something of that nature. So we try to balance out the number of rides per se. There's not a set limit, but we do try to be very mindful of it. And there have been times when we looked at someone who may be using the system a lot to try to balance those number of rides so that other people can use them as well, okay? Let's see, I think I got both of those pieces in there.
Yes, you sure did.
Awesome.
And I know there's questions about the requirements and then the parameters for, and then the definition of the Left Behind Workers Program, which we will get to after Allison is done presenting and get to the rest of the questions. But David, to the lift piece, there are questions about regionality. Will the lift and some of the other transportation, do they hit rural communities?
They do certain ones. It is limited, and we can provide you a list of what those are. Okay. There are certain areas, primarily because in some cases, Lyft just is not operating in that arena, that type of a thing. But we can certainly provide you a list of what are all the various areas in there. Perhaps we'll even provide maybe an FAQ if there's some other ones we can try to provide for you.
All right, wonderful. We'll let Allison move forward, and then we'll move back to some additional questions. So, all right, Allison, you're all set.
Actually, it's a wonderful transition because we'll slide over here. Allison will continue clicking buttons for me, and I'll start over and start talking as we work through some of those things. So what I wanted to do is I'm going to, from this point, I'm going to start just talking about a number of things, and I'm going to be bouncing around between what you're seeing on the screen as well as on a website. So I'm really going to challenge Allison in here, primarily because we want you to also know what information is readily available, okay, and that you can get to pieces of it. The first thing I want to do is just give you a little bit of some insight into where we actually operate. Now, this little picture is a little hard to see, so this is going to be the first challenge. Is we're going to have Allison go ahead and click that one that's underneath there. While she's doing that, I'm going to go ahead and mention that 211, a lot of people see us as a single collective, but in reality, the 211 number is operated by a collaborative of 7 organizations. Those 7 organizations actually have a series of 4 contact centers around the state. And so we sort of have divided the area across the state to accommodate these. So all these pretty colors that you see in here are the various regions. No one necessarily needs to know this. This is simply background. There's all these various regions inside of here. Those top 3 on the upper left, upper right, and that red in the middle, those are regions 1, 2, and 3. And although they are supported by different United Way centers, our Mile High United Way contact center, we actually support all of those counties. And then you'll see there are 3 other counties below. There's a dark blue area that is covered by our partners inside of Pikes Peak United Way. They have a contact center. There is one on the western side that is handled by an additional partner, and the 4th one down in the lower right, that is our friends actually based out of Pueblo that handles that one. So it's it's multiple organizations that provide a seamless interface. So dialing that 211 number anywhere in the state will land you, depending upon where you dialed from, into that correct center. So that's how that operates. As we bounce back over to here so that Allison can move to that next link underneath there, we also make our data readily available. Okay, so we provide annual reports on information. This one here with this wonderful kid and that also special age where you have no teeth. This happens to be the cover of our calendar 2019 annual report. Okay, this is also available on the website, so we try to make that information available. And what I'm drawing your attention to on this one is both at the end of this page, where you can see last year we went just over 90,000 contacts through those various modalities that Allison was talking about. And we're showing where the majority of our calls are coming from. Again, this is representing Mile High United Way's perspective in terms of the those 3 top regions for the calls that we're handling, okay? So you can see some of the bigger counties are, as you would expect, those with the larger population centers. Last thing I'm gonna draw your attention to on this one is that top 5 needs area, okay? And I don't know if you'll be able to make that a little bit larger so we can see it a little bit better, Allison. But this tends to reflect what is often the most common set of needs. Over the number of years as we've worked our way through this, it almost is consistently this set of needs, although they may sometimes shift order. Basically, I'm saying rent payment assistance, housing, utility assistance, shelter, and then some type of income support. So that is usually where it's not necessarily utility, but a family is still struggling to make ends meet. So that's a typical setup of what we see from this annual perspective. Okay, as we switch back over to the PowerPoint, I'm going to move us into a next page. And from here, I wanted to give you a little bit of a perspective. Again, I'm focusing very much off of our Mile High United Way view at this point, which is covering like 23 of the 64 counties inside of the state. Over the past month, so I tried to get you some of the most recent data, okay? The information that we're seeing show up in here, okay? We still have rent payment assistance this month as one of the top ones. Electric service, one of the top ones. Food, starting to show up inside of here. One of the additional services that we offer inside of the center is providing telephone registration for SNAP, Supplemental Nutrition Access Program. I think it's access. I have to figure out what that A is. But in order, when people call in, if there's a food insecurity, we can transfer to one of our agents and they can start the application process right there. We work with the state of Colorado to get them into their system. And then the county has to follow up in order to complete the application, but we can at least get them started, and that helps remove a barrier from there. And it is that that A stands for assistance. So sorry for that momentary pause. The other thing that you'll see in here, now these terms sound strange, but it's because we have everything grouped according to some categorization that is defined nationally so that we have consistency inside of here. But this disease-specific communicable disease control, no one necessarily has to do that. That's how we're tracking the information. But that is usually the items that are related to COVID. So you can see how that's moved up into that fourth level just in this month. But that's often when people are calling in and they want to know more about, am I contagious? Where can I get some testing, or not testing, but where can I find out more information about COVID, et cetera, et cetera. But that moved into our fourth level in this month. After that, people are still working on some housing issues. And then right under it, there becomes the question for the COVID diagnostic tests. What is intriguing about that is that the diagnostic test requests it's been fairly recently increasing. When the COVID pandemic initially hit, a lot of the questions were about how do I handle staying at home? What do I do if I see my neighbor? They seem to be having a party. So they had those types of questions in there. Now, as tests are becoming more available, we're increasingly getting calls about how can I get to that? I'll come back to more about that one. And then just rounding out it, our community shelters, food pantries are included in there. We also provide child care services, child care referrals. So if someone is looking for child care across the entire state, we work with the Office of Early Childhood, and we're able to access their database, locate where that person is seeking childcare, and then provide them information about what resources are available in there. So that continues to be a need inside of even in this time frame. Okay. In terms of our incoming volume, I did a little bit broader perspective, just to show if we push back to March. In that beginning portion of there, you can see we usually have around 2,000 calls or so that may be coming in inside of that given week or time frame. And you can tell exactly when that stay-at-home order began to hit and you start to see the impact. That last week of March is where we saw the biggest hit. We got, I think, just over 7,000 calls coming in that single week. And that is just crazy. I think we had 2,000 calls on a single day in that particular week. And now, as people have begun to settle in a little bit more into this is the normal mode, you're starting to see us fall back more into what is our normal capacity range, although it is up just a little bit, okay? As of, what's that, last week or so ago. So that gives you a perspective of the call volume that's coming in inside of our area, okay? But that's not the only information that is readily available to you, okay? So we're gonna go ahead and bounce out here to show you another level of breakdown for some of the information that shows up in here. On our webpage, inside of one of our locations, inside of our webpage, we actually provide reporting data that can be visible. These are the summaries that we have been building up and making, putting out there. If we go ahead and click on that top one, that's the most recent. I think, what is that? That's June 13th through the 19th. Just take a moment, let that come on up. We'll cross our fingers anyway. There we go. We'll open that up, and yeah, we may definitely have to increase the size of that data. Maybe in that lower right corner, you can make it bigger or so. Okay. Awesome. Okay, so from here, and I'm not going to pour in great detail in here, but from here you can see where we have provided some additional perspective at a statewide perspective. So when we're talking about presenting needs, those are like those categories that I was talking about earlier. Okay, these are groupings of different types of requests that people have called in about. Okay, so in the course of that week, you can see which of those areas tended to be the highest for that. We also have a breakdown per county to show where those calls are coming from. And as one would expect, you know, those counties with larger urban centers, you have Denver inside of there. I see El Paso, where Colorado Springs is. They're going to show up in there. But then there's also an offering we provide that shows a breakdown within each of those counties, what those needs tend to be, just to give you an idea of what's playing out. That final column happens to be something we were working with the state of Colorado on. They were tracking to find out about if people felt that they were not necessarily being treated fairly as they were trying to return to work or so. And so that was an initiative that was put out, or a call put out to say, hey, if you have questions, you can let us know. We haven't necessarily received a lot of phone calls in that area, and so we're still tracking it at this point, but it tends to be a little bit lower. Okay, I'm going to continue on. I'm going to bounce back over to the web, to the PowerPoint. I'll talk about a little bit more as we move to that next page. I have a couple more slides, then we'll stop and we'll be able to respond to some questions. So this particular web page, as we look at it, it provides kind of a different view. I want to share what we can actually do with some of that data, okay? So we have been working with an organization, and that organization helps to provide a perspective for some of the COVID funding. You may have heard of that fund that was set aside to help organizations and communities to address some of the COVID issues that are lying up for them. The governor had put that in place. We served as an organization that helped with those. They worked with a company called Slalom to provide information to the committee that allocates those funds. So they had put together a dashboard that pulls together data that we have in terms of the call and incoming volume, and married it with other data that they had from other sources, such as the number of confirmed COVID cases, to create some hot maps. And that would help inform them on where is a good spot to invest those funds. Now, this particular type of information, this particular dashboard, is not publicly available. It's only available to that committee, but it does show how we're able to sort of take some of our data, and by providing that and incorporating it with other information, organizations are able to use that to try to best direct what actions and activities they may want to fund. Okay, so that's what that one is. If we switch over, I want to make sure I hit a couple of other questions that have popped up. Then I'll pause here, and we can switch over to questions if appropriate. Our process when people do contact us we try to tackle two things. Number one, we try to answer their initial question. Most people are very focused. They know what they want, and it's usually something that is so pressing to them that they are laser focused on trying to get an answer to that question. But when we are successful, we're able to engage them a little further in their conversation to do what we call the second ask. And that second ask is to try to probe them a little bit more about, well, let's talk a little bit more about what it is you're trying to accommodate. And maybe we can offer a resource to address that. I recall one particular conversation with someone who called, and she was very hyper-focused on trying to get mental services for her son who was recently incarcerated. And she was very focused on that, and we couldn't shake her thought in there until we could get an answer to that question. And then once we sort of identified, well, here are some folks that may be able to help, then she could finally hear the question the agent was asking. It's like, well, maybe we should work more on bail so we can get the person out so they can actually attend some of these things. But sometimes you just sort of have to work with clients, and we love doing that, to try to get them so we can offer a surround set of needs. But that's what we call that second ask. Where possible, and when possible, we also try to convey or provide an opportunity to transfer those callers to one of the resources that they may have requested. Most people may leave our lines with 2 to 4 different resources that they want to tackle. And we find that if we can get them to make that initial contact, it increases the likelihood they'll follow up on those activities. For certain types of calls, for example, we have a line that supports the family health line. It tries to address the needs of parents with young children and pregnant women. We try to make sure there's actually a warm transfer over to the next agency that can help introduce them to how to address some issues they may have for kiddos with special needs. It's not always possible because of call volume. Like on that day where we had 2,000 calls coming in, our ability to complete transfers, not nearly as high. But sometimes we have to sort of work our way through that. Okay? So that's sort of it in a process. There was a question about where else are we going? So other things that we are still looking at, in fact, after this call, I have another meeting with CDPHE. We have been working with them to make sure that all of the COVID testing sites that have been identified are incorporated into our database. Allison and her team, they worked very hard trying to get all of that content matched into our system so that if someone puts in a zip code, we can help narrow down, these are the areas that are closest for you. And that is statewide. So even inside of those rural areas, there may or may not be as many, but we can get them as close to you as possible. That's one of the activities we're doing. One of the things that we are excited for is not completely there yet, but we are working towards it. Allison, let's see if this link will work here. While she's pulling it up, I just want to mention there is there's a group, and we call this 211 Counts. It is a wonderful tool. You can see we're that funny color because pretty soon we will be there, just saying that we are on our way. But across the nation, you can click on a site. How about, is that Nebraska over to our right or so? Or, yeah, that's fine. Let's click on one of those. And it sort of gives you a little bit more of a live view of some of the data that that particular state is reporting as a whole. It allows you to drill in more. You can identify at a locale, like a zip code, and start to see like, oh, here is the data that's related for that particular zip code. Some states have it broken down in terms of legislative districts or other combinations. This is what we're hoping will be come kind of close to a public version of that same slalom dashboard that we have made available. or shown you earlier, where you're able to combine some data to sort of see what are trends or what are things that may help influence. So that is something that we hope to have in place with luck this summer to get that data available to people. Back to that PowerPoint, and we'll finish this off. Other things that we have been doing, including working with some folks at in another part of Anschutz. Social determinants of health is really a key factor. I'm going to wager that you guys understand that concept, but recognizing that a person's health is not simply determined by their medical condition, their genetics. You know, there's so many other factors that influence it. If you give someone insulin, but they don't have a place to store it reliably to keep it cold, well, that's a bit of a problem. So that's where we're trying to partner with how do we open up our database of resources to make that available so that that can be partnered as doctors and hospitals are working with patients to get a holistic answer to patients and better meet their needs. Last couple of things, we are working with a wonderful little company out of Boulder. Their name is Radish. They provide an interesting tool that allows you to help move from a voice call to a visual mapping of needs. So we're trying it out in our after hours scenario right now. We are just an 8 to 5, Monday through Friday shop. And when people do call in, if we're not available, we'll ask if they have access to a smartphone. If they do, we will send them a link. That link, when you click on it, will take you to our website, which is device responsive. And then they can look at many of those type of resources that Allison was showing earlier. We have a page that's a little bit more direct and perhaps a little mobile friendlier, but it eventually still goes to our same database, still allows them to self-identify their location and identify resources. And of course, we are continuing to improve and looking for enhancements in our website. How is that for a spiel of a lot of stuff that we have going on? Here's what we would like you to go away with, okay? Be aware of this database, okay? Go in, play with it, you know, just become aware of how it works. I strongly encourage the bookmarking type of capabilities that Allison showed in there. When you bookmark it, it doesn't necessarily lock that resource in place. Instead, it says, these are the searches that was important to you. So if you come back the next week and access that same bookmark, it will then show you the latest information that we know about the items that are in there. And that's very powerful. We're trying to get people to move away from the idea of printing a resource guide. Instead, keep it as current as possible. That's what that team does all the time, is bring those things up to date, okay? Finally, I would also encourage you that you know your clients' needs so much better than anyone else. You've developed a relationship with them. You understand them. So help them translate what's important for them. You know, encourage them to go to the website. Many times once someone gets inside of there, they can locate a resource, but then invite them to just poke around, okay? And as they poke around inside of there, they might be able to find other resources that meet their needs, okay? So that's what we're gonna end with. We'll switch over to some comments and questions, and thanks for letting us prattle on for a little bit, okay? Do you have any questions out there, Andrea?
There are. Well, thank you so much. I have to tell you, even Erin and I were talking about for the Navigator Training Collaborative, how much we've always worked and made connections, but how we even need to be stronger about making the leads to the 211, because the data, the information, the connections to real-time issues and resources that pair, fantabulous. So kudos to you guys for all of the amazing work. I'm gonna, there's kind of some clumping of questions, and I think there's a few in the chat that I'll have Erin help me with as well. So as I noted earlier, there's questions, and let me try to go through to get all of these together. What is the Left Behind Workers Program, if you can reframe that, eligibility requirements, and who qualifies? Let's see, do you have to be a U.S. citizen to qualify for those benefits as well? So I think those are the ones for the Left Behind Workers Program,
Sure.
and then we'll get into the rest.
Okay, do you want to tackle it, Allison, or would you like me to go for it?
I can, sure.
Okay.
So the Left Behind Workers Fund was actually designed to meet the needs of people that are not citizens. They kind of had it in mind for the immigrants without documentation population when they created this fund. And they wanted to create a fund that would not count against them with public charge, that would not be associated or directly linked to government agencies. And so this nonprofit gathered all of the funding they could and established partnerships with various nonprofits across the state, and are working to get just cash money distributed to folks as quickly as possible that didn't have. So for eligibility, the main pieces are you have to live in Colorado. You have to have been impacted financially by COVID-19, as in losing 20 hours of work or more, or losing your job entirely because of COVID-19. You have to have not received a stimulus payment from the CARES Act, and you must not be eligible for unemployment benefits. And that's it. Those are the 4 eligibility criteria.
And one thing I'll say about the nonprofit that is working through that, you're not going to hear marketing on this particular item, okay? And it's because they are trying to very much focus this to meet that targeted population, okay? And that's why I wanted to offer a little bit of insight into there in terms of this word of mouth, in terms of communicating that info. Because there is going to be a limited amount of that fund. And they want to try to meet those needs as much as possible. We have partnered with them so that as we are having people call in and we're doing like that second ask, for example, in terms of what those needs are, if we can identify they are potential folks in there, we'll run through those same kind of questions and then let them know about that. We're also creating some distancing so that clients will feel safe, that their information is not being captured in a way that makes them uncomfortable. So that's what that is. But if you have someone who seems to satisfy or meet that particular set of criteria, if they call and ask us about that, we will certainly provide those same kind of guidelines to them.
Okay, great. And then I think one of the questions, and I think you mentioned this, Allison, that people don't have to be U.S. citizens or documented. Is there any, also, I know social security numbers can often be, do you have to have a social security number?
I don't believe so, no.
Okay.
You don't.
Okay, great. I'm going to move to the next set of questions. This one is a pretty discrete questions specific to water bill and if there's support. Do you know of any resources for people wanting or needing help specifically with water bills?
It is a really difficult resource statewide to try to address. In certain areas, there certainly are some options available. We know that we have worked with Denver Water to help those who have been disrupted for a particular reason, address their water bill needs, but not if there is a systemic pattern of not being able to make those needs. So we have that portion in there. Allison, are you aware of some of the ones inside of more rural areas?
I'm not aware of any specifics.
Yeah.
I also know that we'll direct people to undesignated temporary financial assistance. So we have several programs in the database that don't call out specifically what the money has to be used for. And it can meet a range of needs, including that water bill.
Okay.
And in fact, I just want to point out, you heard her use a very fancy special term, undesignated. So if you are on that same search page that she showed earlier, okay, if you go into there and you start talking about undesignated, all right, you may see some items pop up. Click on those, and then you can sort of see what items may show up to help clarify that.
Okay. So here's a good question, I think, about triaging questions. So for public health workers who are going to be serving in the role or are serving as contact tracers or resource coordinators, which types of resources, like which topics should we or our client call for live help, and which should we do for research on our own? You guys have an idea of kind of what the threshold or a kind of a cutoff line where these are ones that would be better and easier just to call about. These are the ones that are just easy enough to research on your own. I think that's the question.
We don't have a good answer for that, and that's some of the conversation we're having with CDPHE.
Okay.
We've certainly been doing work with them in terms of their COVID testing. They know that they will be overrun as they start doing some of these contact tracing activities, and so they're trying to work with us to help identify those. But just as a quick response, there are going to be basic resources. We know people are going to need food. Certainly look inside the database and just work through those kinds of things. I think we're going to have to get a little bit more experience and some feedback from CDPHE to try to understand what might be some additional ones to push beyond that.
Okay.
Okay.
Good deal. The question is also then, in terms of utilization, what are the wait times to get live help? And are there certain days of the time or certain days that are better to call than others?
Absolutely. As with anything else, that is always a challenge. In general, we do try to answer calls in a very reasonable time frame. During that huge period, the delay times were just horrible. We do have some capabilities built into the system so that even if someone does call, if they can't stay on the line, they can request a callback. Basically, it stays in line for them. That finally gets to an agent, and when it drops on that agent's phone, they will call them back. But in a normal mode, we usually can answer calls within 2, 3 to 5 minutes. Our worst time of days is lunchtime, because that is the time when the entire city, country, or state, everybody goes on lunch and everyone decides to call. And so that is certainly a tougher time. So if you catch us in the morning, like between 9 and 11, great time. 1 and 3, great time. There's always seemed to be a rush also right around 4, between 4 and 5.
Good to know. I think these are super helpful tips for people to consider.
And I'm sorry, you also asked days. So midweek is better. Okay, everyone calls Monday morning because they thought of stuff over the weekend. Okay.
Very good. All right, awesome. So one of the final questions in the Q&A, and then I'll have Erin help me with anything new in the chat that's come in. Is there any direct partnership with Aunt Bertha and 211 at this time?
There is not. Aunt Bertha also has resources in play. They've certainly worked nationally in terms of getting that content and information out there. I can't speak to all of the processes that they go through. One of the distinctions that we certainly pull out in terms of our 211 is the power of Allison's team. We have live people who respond to live actions and make sure that that data is always up to date. Because we have an actual contact center associated with it, when we're speaking with clients, sometimes clients will tell us, you have this resource here, I just spoke to them, they said they have no more funds. And within that hour, we turn that resource off, so that no one else will get that type of resource. So that's what we bring to the table in terms of making sure that that curated data is always accurate and it's not older information.
Right. Well, speaking of bringing things to the table, you guys have been phenomenal. Thank you. We've learned so much. It's just awesome to see all the great work. Thank you for being a resource and a conduit, I think, when something like this happens, that you can move and pivot. So a million thanks. I know you both have a hard stop right at 2. It's now 2:01. Allison, David, thank you so much for coming. We are going to go ahead and close this out. If we have additional questions come in, we'll email them. And thank you too for both being on, and delighted to have Paulina join us. So thank you too. Have a great day.
All right. Thank you guys. Bye-bye,
Bye-bye.
everyone.
Thank you.
Mhm.
So Paulina is going to be our next presenter. And Paulina, welcome. How are you?
Hello.
Hi,
Very good. Thank
Paulina.
you. Hello, everybody. Thank you
Hi,
for
thanks.
inviting me.
You're welcome. So we're really excited to have Paulina share a bit further about resources specific for the Spanish-speaking population. And Paulina, as I understand it, really you guys stood up and really responded quickly to some need within the community for the Spanish-speaking teams and community for COVID-19. So we're very excited to have you share more about that work. And if you'd like to formally introduce yourself and your background and Adelante, that would be fantastic.
Of course, and I have some slides too. So
Wonderful.
I have a half an hour now, right?
You sure do.
Okay, so I'm going to go a little faster and I may skip some things. So you can feel free to contact me if you have any questions at the end of the presentation. There's going to be my contact information. So, well, hello, everybody. I bet you have all been in Zoom meetings all day. So let's take a big breath and ooh, that's
Yeah.
the first thing, and I have to do it because I'm a Latino woman. That's just how we roll it. Whenever we start talking about the things that are close to your hearts. So I am Paulina Erices. I am the maternal child health specialist at Jefferson County Public Health. And I have the honor of working with community members in Jefferson County and other counties as well for the last year and a half in a community-driven initiative that's called Adelante Network. And that's what we're going to be talking about today. So I have like the three-part presentation. The first part is more about the framework of how we do Adelante work in order to be respectful of community voice and leadership and power within the spaces that we work together. And then I'm going to tell you a little bit about Adelante, and then we're going to talk about this specific COVID response. So let's see if I can get to my presentation. And I hope you can all see this. Yes, give me a thumbs up if you can see my screen. Awesome. So we're just going to skip a few things here. Adelante JEFCO, that's how we named it a year and a half ago, and we are the Latino Network for Health and Education, la Red Latina de Salud y Educación. Adelante is funded in the CVPR principles, and that's community-based participatory research principles. We don't do research with people, but we do use these principles to keep us straight and honor all of these aspects of community engagement and involvement. We talk about systems development, we talk about cyclical process of learning and co-creation together. We highlight the local relevancy of not only the needs of the community, but also the strengths, the assets, the things that are happening already, because we recognize that our community are experts in what they do. They have been navigating the systems in ways that we often don't know about and have been successful doing that. And we want to create a platform for them to continue doing that work, and also for us to learn and to bring to the table creative solutions in that space. We also, whenever we collect data, we recognize that that data belongs to community members as much as it will help inform any initiatives that I can have from the health department, right? So it's shared knowledge, shared learning. We commit to sustainability, so we don't go to community just asking or offering one project in particular, but really bringing a broad perspective of developing a partnership and identifying common goals for long-term change. There's a lot of cultural humility in this, in which we have to come and learn. So.
Paulina, sorry to interrupt. Do you want to click the full slideshow button, and that'll just make it a little bigger for our audience?
Of course. Is that better?
Yeah, it looks perfect. Thank you.
Awesome. Thank you for that. So through community-based participatory research principles, we demonstrate respect for community autonomy. We seek solutions for community members to lead those solutions. And also we provide a space in which community members have control over the conditions and impact their health. We started with a focus on 0 to 3, and we quickly learned from community members that, yeah, we don't classify our families by age. So if we were not going to look at the whole family, we were not going to be successful in our intentions. So those are things, examples of what we have done. The vision is a society where each parent has the tools and the power to raise healthy and happy children, where they can direct the creation of community resources, and where they are valued as the experts in health, education, and well-being of their families. That's what we center our work, or where we center our work. I'm not going to show this video, but you can go online and see it yourself. It's a short video from a year ago, about Adelante and the role of our community members when they were selected as public health champions for the county. And we talk about the efecto Adelante, el efecto Adelante. Through Adelante, and because of the trust that we have developed with community members, we're able to spread the word very effectively throughout the community, and it becomes a movement. And I'm not making this narrative out. This is something that community members say. So it benefits them in order to spread the word about their initiatives, their concerns, their activities as well, and it helps us as well as a public health agency to provide appropriate support, effective support to their initiatives and the needs that we see in the community. Cultural humility is the only way. We have to respect and recognize the values and principles that our families embrace, our community embraces. And whenever we listen to our community leaders, we know that we're getting allies. And all of those goals that sometimes feel like so disconnected from community members can transform and align. And then we have goals that are powered by community. So as you can see here, we do all of our planning, all of our implementation, evaluation with committees that were created by community members. We have representatives of organizations and community members working together and elevating the capacity of community members to influence decisions and elevating the capacity of organizations to respond more effectively to whatever community members are expressing. We also have a lot of social stuff. So we do a lot of even camping trips, visits to museums, forest therapy. That's the latest one that we have been doing because of COVID. We are a place for healing, and that's really important to us. And parties, I forgot to say, the amount of cooking that we do, the partying and the connecting in a deeper way is really important. I can tell you, I felt that I have friends in Adelante, and that's part of my work, and there's nothing better than when you get to the work that impacts the families and the people that you love. They also participate in the creation of this amazing website, and we also have partnered with and contracted with early milestones for several initiatives within the county in education, health, and just a bunch of initiatives in which now we have leaders from Adelante sitting at the table and making decisions. So when COVID started, well, I was activated in the emergency response mid-February. And as soon as that happened, we started communicating with community members to get ready and to start learning how to use the tools that will allow us to continue communicating if this pandemic response will require to stay home, for example, which we were anticipating. So as soon as that was the order, as soon as I was sent home from my office and I had to carry my computer monitor, even the chair, to be able to continue working from home, we started Adelante, on the lower side, a daily community check-in. And this allows you to have an immediate connection with families. We had 25, 30 people and sometimes bigger every day, especially in that first month, in which people were asking questions about COVID, about food, about jobs, about anything that was coming up for people in their daily life. That was extremely important as a situational awareness for me in my role as a whole community inclusion person in the incident command response, to be able to quickly identify strategies from human services and public health perspectives to support families. We also started quickly the prenatal series because many people who were expecting were really concerned about this. Our support group for families with children with special needs moved from in-person meeting to weekly visits with families, knowing that because of the school moving to home, those families were particularly at a higher risk of total disengaging from school, of mental health concerns, or lacking access, having more barriers for access to to services in health. And we also started groups with, or consejeras de lactancia, that's another group that we have within Adelante, providing support for families with very young children. Soon after that, and because of these massive meetings that we were having in Zoom, we identified that we needed to provide some level of support that was one-on-one. And a year ago, no, October last year, it feels forever, and at the same time, just yesterday, we had worked with CU to provide a training for community members, community leaders who wanted to become patient navigators. We had consejeras de lactancia, we had people working in gardens, and there was a group really interested in looking at this career path to develop. So they received level 1. And as soon as we started identifying and having the conversations about, we need like people to call a number and have someone familiar with the experience to answer and support them. And someone also familiar with the resources available. So we decided to create this Navigadores Comunitarios. It started just as a phone number, and we created a process for documentation and follow-up. It was at the time right before, I would say few weeks before, I believe it was, yeah, just a few weeks before we were told that 211 was going to take care of like the whole state. So at that point, I was actually in charge in my county to create a database of resources, and I was strongly working also in Spanish-speaking resources, knowing that those are not that as available. So we started working with this. We started receiving calls. The goal of, I'm gonna go to the next one and then go back. The goals of the community navigators are a little bit deeper than just a call center. We do research and provide information about available resources, and we check if our Spanish-speaking, sometimes undocumented individuals will be eligible for those resources or not. So we dig a little deeper. And then we work really hard in building the capacity and confidence of the community members to seek those resources on their own. We always define our role pretty much as like more like a coach that's helping this family to learn to navigate the system as they are doing it, especially now in COVID. We anticipate those needs and identify the needs that community members may have in anticipation. And that's where our navigators have been trained to be like very sharp in seeing, and like when we started seeing the use of masks, what are the questions that are going to come from our community, and then what are the information and resources that they will need in order to make the best decision for their health and their family's health and their community's health based on the new recommendations of using a mask. Then we support individuals and families in making informed decisions for their own health and the health of their community. This is at the end of the day, what we're hoping to accomplish here is to really building up that capacity of our community members to reach resources effectively, to navigate them, to be successful in getting what they need. By building up their strengths and also connecting them with the organizations if we're seeing that that's not happening and our community members are doing the work. So we are also one of the organizations distributing the Fondo de Alivio para Trabajadores, so the Left Behind Workers Fund. And I have here the requirements. I actually deleted the phone number in this one, and I will tell you why. And I believe in the previous presentation, there was a little bit of that. So in terms of intention, reach, and results, we believe in a hyper-local response to a global pandemic. Initially, I honestly thought that this was gonna last a couple months, 3 months maybe. And as we started working on it and we started seeing the deep need that our community members have to have someone listen to their stories, to be that space of healing and conversation, even before we can start talking about building up skills to call a phone number. They need to be listened to. They need someone who has had the same experience on the other side to be able to really understand what are the barriers to access that family, that individual is going through. We do seek feedback and do follow up with them. So the navigators will call them back or send a text a few days later and then a week later, just to make sure, were they able to reach out what they needed? Is there anything else that we could do? sadly, for a long time, before we got the Workers Fund, there were many times when we had to pretty much hold someone's hand virtually and to say, at this point, there's no much that we can find, and have to find creative ways to get resources, like connecting them with food versus rent. So whatever rent they will have, or money they will have, they will use for rent. Sometimes even reaching out directly to foundations to when we identify like severe needs. We offer very intentional trainings and mental health supports to navigators, because these are people who are going through pretty much same experiences as the people who called the line. So as we were working to help with rent, or navigators, several of them were needing rent assistance. So,
Paulina,
yep.
A question for you that's come in a couple times now. Do people, to utilize the resources, the resource line, and then your navigators, do they have to be from Jeffco?
No.
Okay, so it's open. And then the number that you did provide earlier, that was for Spanish-speaking navigation assistance. Is that correct?
Yes.
Okay,
yes.
Wonderful. All right,
it's all Spanish speaking, and it's all Latinx driven and led, and it's open to the whole Denver metro area.
All right, I think those are the answers that people wanted to hear. So good work. All right, sorry to interrupt. Keep going.
No worries. Thank you. And whenever you have questions, just go for it. So we are training or building up the capacity also for navigators. So we don't want people in the line who are experiencing compassion fatigue or burnout, because we know that prevents them from providing a good service to people. They need to be able to connect in an authentic way. So we provide them with a lot of supports in that area, and also continue building up their skills as community navigators or patient navigators, promotores. There's a piece of education that we do that's very strong. We received until last week, and this is where the distinction comes, we had received about 1,500 calls in the Denver metro area, maybe 100 calls from other counties. They were mainly related to rent assistance, food access. Where do I go to a food bank that actually provides the foods that I like to eat, that my family will eat, that will be more responsive to my cultural needs, that will have someone who speaks Spanish in the entrance, where they are not going to ask me for all of these documents? Where can I just go and feel that I'm safe? Those were questions. Where can I go and get mental health support because I'm really struggling at home and I'm alone? The roles of caregivers, we ask them in our documentation, we ask them if they're taking care of children and if they're taking care of elderly people. So then without, like, they start telling us the story, really, once it opens, poof, we get the whole story. And that's why it's so important for us to also have the skill sets to support, they all receive a psychological first aid training, so to support them in a very evidence-based and safe way. And also the health needs. So a lot of people who had Covet, who needed extra help, who needed food delivered to their doors, we were able to arrange all of that and follow them with testing and, you know, all kinds of stuff that we were listening to and trying to support families with. Now, since we started receiving the Workers Fund, the word is spread out extremely quickly. And we have about 2,000 calls in the last week. More specific to this fund. So our navigators are working on returning those. We're not taking more calls for the Workers Fund, but we are continuing doing the navigation piece. We have 20 to 30 navigators depending on the volume of calls that we receive. Some weeks we have 500 or 1,000, and some weeks we have only 10 or 20. So it really varies on what is going on. And they are rotating and they are representing local communities. So we have people from Adelante, but we have always, Adelante is a very inclusive network. So you can actually be in another organization as a volunteer and you're part of Adelante and you can engage in several ways. It's not exclusive. We're not a nonprofit, we're networks. So we have people from Cultivando in Aurora. We have people from Revision in Denver that have joined these navigators to be able to represent those local communities and be more knowledgeable about what is happening locally and who can help locally. We have 2 coordinators who will screen the calls, refer them to the appropriate navigator for that topic in specific. We even have navigators who specialize in businesses, small businesses, applications for unemployment, all of that kind of stuff we did. And now we are really focused on this fund and also working with agencies. And this may be more specific to Jefferson County because that's kind of my job, making sure that our agencies have also processes that are culturally and linguistically responsive for our community. So that may be a more specific piece to Jeffco. So let me make sure I did not miss. So something that we do and how we move in the world with this Adelante and with the community navigators is that we want to talk about the ways we thrive and redefine resiliency, not as a survival of trauma. I suffer when I see that that's the expectation. What I want to define as resiliency is the creativity and drawing strengths from our redemption narratives and from each other. We have a very strong community that has come together to help each other, to support, to build systems, and are standing up. And now, even if I thought we'll do this for 2 to 3 months, they're telling me, no, we're doing this forever. And they were like, do you want to join or not? Because they're going to do it anyway. And it's an honor that they have chosen to continue working with me, and yeah, that that we are able to partner as a public health agency. I'm happy to provide the platform for this to happen, but really the work is being done by community members. And questions?
That was beautiful. Well, thank you so much. And I have to tell you, some of your slides were really quite attractive. They just felt very nice and comforting. So thanks for this. It was wonderful. Going back to a couple of the questions I think we had earlier, the one question was, do you know of any other community orgs throughout Colorado that are offering similar services like you are in Jeffco, that are, you know, really tailored to their community for Spanish speaking or for specific populations? Anyone in particular?
Unfortunately, I don't. We have been receiving calls from other counties seeing if they could set up something like this, and we'll be happy to help. That's what we do, right? But not that I know. And our hope as Adelante, even before COVID happens, was to build networks in other counties in the Denver metro area or outside of the Denver metro area. So this hyperlocal work could also be happening somewhere else.
Sure. Okay, good. Sounds like you're open for people to contact you about what's working, different opportunities. And then I think the question around people like navigators, your navigators and call line responding, you know, well beyond Jeffco. Are you open to people from all throughout Colorado calling, or is it just Metro Denver? What is your general parameter?
Right now, we will prefer calls from the Denver metro area. We're not going to say no to anybody else. The issue is that since none of us works in outside of the county, the Denver metro area, I mean, it's really hard for us to connect with resources that we could trust from a community perspective. So I have called several other counties trying to find resources, and it's just different to have that community perspective that we seek, that feedback that we want from the community versus the agency perspective. And sometimes, sadly, we find that there's a mismatch. So I suffer if I have to refer someone to a place where they are not going to get what they need, or they end up calling us back every single time if that doesn't work.
Okay.
So, yeah.
Right. So it sounds like being responsive, but being responsible and knowing the limitations. One of the questions that I had from one of our colleagues is, are you also, just as you know, 211 and our friends David and Allison were on earlier, do you also use 211 in your resources for the searches? Okay. So this is really integrated into into connection. Okay.
So we do send callers over there for, especially for, we use their database and we send people over there when we don't have resources available that they may have.
Okay.
But then our navigators do their follow-up and they continue doing their navigation process.
Okay.
So it's one of the resources.
Good deal. And I think for everyone on the line, I'm always reminded when Fermin, prior to David, was managing the line, that the resources that are in 211 are as good as the information that people provide. So a quick reminder that if there are resources or opportunities or updates, you know, trying to be as pragmatic about sharing that. I know 211 does a good job of following up to make sure resources are timely as well, but getting that cataloged is the name of the game, and everybody, working relationally as well.
Yeah.
So this is outstanding. Let me just make sure I'm not missing any questions. I know I have some additional thoughts as well. Erin, are we caught up on all of the real-time questions so far?
Yes.
Okay.
Yeah,
Very
and
good.
I have a question whenever.
Go ahead, Erin.
You go ahead.
Yeah.
So you had mentioned about moving like support groups online, and we've had this kind of ongoing dialogue. How do navigators continue their work in this time when they're used to being in community, and that was such a key part of their role? So can you just briefly expand on how you've adapted to the current pandemic as far as the outreach work and the other aspects of the work that your navigators do?
Yeah, well, I think that we reframe what social distancing means, and we started calling it loving distancing. So we're just keeping each other safe and healthy and all of that. And even before COVID, we started playing about what are the new ways that we're going to say hi to each other. So we did, when we were in person, we were preparing for this. Probably didn't expect it to be this long, but it's really having humor, having compassion, having understanding, and having like a partner. So we have like buddies that could help each other, that are keeping an eye on each other. We did prepare people to start using online technology. I made sure like who's missing, who is going to reach out to that person that we know is missing here and help them to come in to this space where technology may be a challenge. Really doing that intentional outreach and building up their skills. And now it's fantastic because our community members are using Zoom for their meetings. They're using interpretation. All of our meetings, whenever we have someone who speaks English, are all interpreted, and most of our meetings are all in Spanish. Well, yeah, the facilitation is all in Spanish, and then we have interpretation to English. And that's something that Zoom makes so easy. So we have been able to bring experts to our conversations from all around the world, because now we can have access to them so much easier. So it's making it very fun, and we keep making games, and we keep finding ways to just continue being connected. We have done like exercises, like whatever comes up. It's really following the lead. Relaxing a little bit, the formality of it has helped a lot. And centering that we all have kids around. I have 3 kids. I'm always hiding from them. I have done my meetings inside the closet, so just being very human. Remember that at the end of the day, that's what keeps us connected and safe. And we're all in a trauma response.
Mm-hmm.
From the really beginning, that was so evident. People, I can tell you 2 things. Like last year, the biggest meeting that we had was the meeting right after El Paso shooting. And that was in person. This year, the biggest meeting that we had was the meeting right before we were sent home. It was right the week before the pandemic was like announced as such. People wanted to connect. People wanted to be together and to know that at least we had each other. So we had those conversations moving into virtual spaces and creating the skills and the access. So we connected with schools and libraries very quickly to get people Chromebooks and internet connection, and making sure that they were signing up for free Wi-Fi or whatever, or how do you use your phones, and reaching out to friends who may have an extra phone or computer. So they could be given to those people who we know were at higher risk of isolation. I don't know if that answered your question.
Thank you.
I think it did. And I think, Paulina, the one thing, and I know we're right at time, is I think so many people have said, we all do the best we can do with the information we have in the moment. And we're all, no one has this figured out. And we're all kind of in that same place of being able to traverse and move forward, and that we're not alone that way. So giving ourselves some grace and not such extreme pressure is probably a huge thing. But I just want to say a million thank you, what you provided today and what you guys have done to be responsive. 211, I think that the adage that, necessity is the mother of innovation. I mean, there really is so many good things that we've seen people do, some heroic and amazing things. Thank you so much. We are going to continue to keep updated for the resources. We'll continue to keep connected with you and the 211 team moving ahead. Thank you, everybody, for all of this time. We are right at the bottom of the hour. So I will turn it over to Erin for our final closeout. And again, Paulina, thank you very, very much.
Thank you. Thank you all.
All right,
Erin?
everyone, thanks for your time today. A survey will pop up once you exit out of the webinar. You know we love our evaluations. It helps us continue to offer these programs free to you. So please take a moment and tell us what you thought. And I will follow up with the recording and you know, a list of the links that we discussed today. So thank you all for attending, and we hope to see you next time.
Thank
Bye.
you.